Hello everyone, today I am going to talk about the syllabus of the CARE course for high and low blood sugar. The first is the blood glucose value, the second is hypoglycemia defines the symptoms and treatment, and the third is the hyperglycemia defines the symptoms and fourth, prevention and follow-up, recognize blood glucose values, blood glucose normal range, fasting blood glucose less than 100. 2 hours after a meal, blood sugar is less than 140. Glycation hemoglobin is less than 5.7. In prediabetes, fasting blood sugar is 100 to 125. 2 hours after a meal, blood sugar 140 to 199. Glycosylated hemoglobin 5.7 to 6.4. If the diagnostic criteria for diabetes mellitus are met, fasting blood glucose is greater than or equal to 120. 2 hours after meals, blood sugar 200 or greater. Glycosylated hemoglobin greater than or equal to 6.5. What is hypoglycemia? Blood sugar values below 70. Blood sugar drops rapidly from high concentrations to high concentrations, although blood sugar is still biased. High levels may also cause symptoms of hypoglycemia. Be careful here. The severity of hypoglycemia is not determined by blood glucose levels, but by symptoms and why hypoglycemia occurs. What about an overdose of insulin or oral medication on the first and an overdose on the second? After injection or medication, not eating according to the time of eating, eating only vegetables and meat is ingested. Rice and pastry-related ingredients. Fourth, suddenly increase the amount of exercise to supplement the appropriate amount of dim sum. Fifth, drink alcohol on an empty stomach. What are the symptoms of low blood sugar? You will feel night sweats, shivering, and dizziness. Hunger and palpitations are severe. How to deal with low blood sugar if you faint first? Those who are awake. Blood glucose below 70 should be measured immediately, indicating hypoglycemia, and patients without a blood glucose machine should be treated with hypoglycemia. Supplement with 15 grams of sugary foods immediately. For example, sugary drinks, 120 to 150 cubic centimeters, 3 to 5 sugar cubes or candies, a spoonful of granulated sugar or honey. Here we would like to remind everyone that the symptoms can improve after about 15 minutes of treatment. If they do not improve, sugary food should be taken repeatedly. Continuous treatment here twice still does not improve. Please seek medical attention as soon as possible if it is unconscious. It's also the same with immediate measurement of blood sugar below 70 to indicate hypoglycemia. At this time, a tablespoon of honey or granulated sugar is poured into the mouth of the patient's head to help massage the cheeks to facilitate absorption. If you have a glycan at home, remember to inject it intramuscularly or subcutaneously with the help of others. If symptoms do not improve after 30 minutes and 30 minutes, please go to the doctor as soon as possible. How to prevent hypoglycemia? First, measure blood sugar frequently. Second, regular and quantitative meals or snacks. And third, when there is extra exercise, be sure to supplement with the relevant sugary snacks if you have symptoms of poor appetite when you are sick. Please monitor your blood sugar more. Fifth, after injecting insulin or taking oral hypoglycemic drugs, eat at the same time. Carry sugary foods with you anytime and anywhere in case hypoglycemia occurs. Carry your diabetes passport or contact information with you. When there is a severe lack of insulin in the body, the carbohydrates ingested cannot be used efficiently by the cells. As a result, it accumulates in the blood, causing high blood sugar concentrations, and high blood sugar can cause a lot of loss in the body. Hydration, changes in blood osmolality, and electrolyte imbalances. Diabetic ketoacidosis often occurs in people with type 1 diabetes. Acute illness or insulin deficiency may also be seen in patients with type 2 diabetes. Ketones will be produced, blood glucose concentrations greater than 250 or more, nausea, vomiting, abdominal pain, breathing soundly and almost fruity, dry skin, high osmolality. Hyperglycemic states are more common in people with undiagnosed diabetes or older people with type 2 and 2 diabetes. The body is slightly bright, or there is no homogeneous production, the glucose concentration in the blood is greater than 600, and the mucous membranes are dry. An increase in body temperature changes. What do we do about high blood sugar? The first is to have enough fluids to rehydrate, and the second is to give enough insulin to repair and maintain normal glucose metabolism. The third corrects electrolytes and acidemia, and the fourth is given when needed. Glucose. Fifth, prevent complications. Everyone knows how to prevent high blood sugar. The first is to take the medicine or inject the specified insulin on time. The second is to follow the diet plan, and the third is to follow the diet plan. Pay attention to blood sugar control every day, and go to the hospital for follow-up visits to the fifth case every day. Be alert for symptoms of hyperglycemia. Finally, everyone must know that diabetic patients should be followed up regularly. It is recommended to track the items there. First, check your eyes once a year. Check your teeth once in the second 6 months. And third, regularly follow up glycosylated hemoglobin proteinuria. Fourth, regularly follow up for the prevention of high and low blood sugar in the above stages. Are you all clear? Center for Health Promotion for Diabetic Patients. Caring about you.